Welcome to the Nutritional Guidelines for Individuals with Heart Failure presentation, narrated by one of Niagara Health's dietitians. This presentation will cover the following topics: an explanation of heart failure, the role sodium plays in our bodies, specific nutritional guidelines when following a low sodium diet to manage heart failure, the different types of sodium in food, how to read food labels to check sodium content of foods, and additional information about a low sodium diet. A fluid-restricted diet will also be reviewed, as well as some ways to manage fluid intake when on a restriction, as well as managing thirst. To begin, let's define heart failure. Heart failure occurs when your heart is not able to pump enough blood to your body. The heart muscle becomes weak or stiff. In this case, fluid can build up in different parts of the body, such as the lungs, abdominal area, and legs. You may also hear heart failure referred to as congestive heart failure or CHF. There are several different potential causes of heart failure. These include history of a heart attack, high blood pressure or hypertension, coronary artery disease, heart valve problems, a heart muscle infection, alcohol and drug abuse, certain medications and types of chemotherapies, as well as genetics and family history. The following symptoms may occur when you have heart failure: fatigue and generalized weakness, shortness of breath, swelling in feet, legs, or abdomen, sudden weight gain related to fluid retention, poor appetite and therefore decreased oral intake, as well as feeling like your stomach is bloated or full. Now that we have reviewed what heart failure is, let's talk about one of the key components of managing it, this being a low sodium diet. What exactly is sodium and why do our bodies require it? Sodium is an electrolyte that regulates the amount of fluid in the body, helps to maintain blood pressure, and has an essential role in muscle and nerve function. Although we do need some sodium from our diet, eating too much of it can make your body hold on to extra water and cause fluid buildup in legs and other body parts, as well as increase blood pressure beyond the desired level. At this point, you might be wondering how much sodium you should be eating in a day. When a low sodium diet is recommended to you, you should limit sodium to less than 2,300 milligrams per day. Now, if you are wondering if table salt is the same as sodium, the answer is yes. Table salt is a source of sodium, but there are other sources in the diet as well. There are three main ways that sodium can make its way into our diet. The first is through added salts, next is what can be referred to as hidden sodium, and finally naturally occurring sodium. This will be broken down further in the coming slides. Let's tackle added salt first. Added salt comes in many forms, the most common being table salt, but you may have heard of or tried others such as pink salt, kosher salt, sea salt, iodized salt, Himalayan salt, and rock salt. The key takeaway is that salt is salt is salt. None of these examples of added salt are better than the other. They will all contain roughly the same sodium content when measured by weight. The first step in reducing added salt intake is to start with the salt shaker. If you are someone that shakes a lot of salt on your food during food preparation and cooking, or at the table, start slow by reducing the amount of shakes you would normally do in half. So for example, try 2 shakes instead of 4, and then slowly over time, try just 1 shake. It may take a couple weeks for your taste buds to adjust, but they will do so the longer you follow a low sodium diet. Lower sodium foods will slowly begin to taste more palatable, and high sodium foods may begin to actually taste too salty. Here are some low sodium seasonings to try. Add commercial salt-free seasoning blends to flavor your food dishes either during preparation or at the table, such as Mrs. Dash, McCormick's salt-free, Clubhouse salt-free, or President's Choice Blue Menu no salt added. You could also flavor your food with fresh or powdered garlic or onions, as well as fresh lemon or lime juice to give them some extra flavor. Other ways to flavor food without sodium are by adding fresh or dried herbs and spices to food, using flavor-infused oils, adding hot sauce, using vinegar, and giving the black pepper shaker a try instead of the salt shaker. In addition to added salt that is often easier to recognize, there are hidden sources of sodium that also contribute to our total sodium intake for the day. Examples include sodium nitrate, sodium phosphate, sodium bicarbonate, and monosodium glutamate. Just because a food product might not taste salty to you does not mean that it is low in sodium. In fact, many foods that do not taste salty are high in sodium, such as frozen TV dinners and deli meat, just to name a few. Check the ingredients list for these hidden sources before you purchase a packaged product. The key takeaway here is that it is more difficult to limit your sodium intake when it has already been added during processing, as opposed to by you during cooking. Here are some examples of seasonings and condiments that are typically high in sodium: soy sauce, teriyaki sauce, steak or HP sauce, barbecue sauces, monosodium glutamate or MSG, garlic salt, onion salt, lemon salt or celery salt, and many others. However, many of these products will have low sodium versions of them available. To determine whether a seasoning is high or low in sodium, the nutrition facts table must be read, which will be covered in the next slide. Let's talk about the nutrition facts table. As we know, sodium is added to many food products by food companies to enhance flavor or act as a preservative to increase shelf life. This sodium is often referred to as hidden sodium, as discussed previously, and is often the largest source of sodium in our diet. It is important to note that the nutrition facts table includes both added or hidden sodium, as well as naturally occurring sodium. In order to find out how much sodium you are consuming when you eat a food product, the nutrition facts table should be read. You probably recognize the table shown on this slide, as it is found on the majority of packaged food products we consume in Canada. The nutrition facts table can help you make informed food choices when grocery shopping and preparing food at home. The table lists the amount of various nutrients that are found in a food product, including sodium. Although other nutrients can be important to consider, we are going to focus just on sodium for this presentation. Sodium is listed around the middle of the table. The amount of sodium is listed in milligrams as well as in percent daily value. When looking at milligrams, 200 milligrams or less per serving is considered low sodium and a great food choice. 200 to 400 is considered higher in sodium and therefore should be eaten in limited amounts, and more than 400 milligrams is considered very high, and a product like this should be avoided. Now on to the percent daily value method. The percent daily value can be used as a quick way to determine if a product is high or low in sodium. 5% is considered a little bit of sodium and a good food product to choose. Between 5 and 15% is a moderate amount of sodium, and 15% or more is considered a lot of sodium, and products like this should be avoided. Whether you look at the milligrams or percent daily value, be sure to check the serving size in comparison to the usual portion you consume in order to determine the amount of sodium eaten. For example, if a product has 400 milligrams of sodium per serving, but you ate 2 servings, then you must multiply the milligrams by 2. The same math must be considered if using the percent daily value. Here is an example of the nutrition facts table for 2 versions of chicken noodle soup. On the left is the original product containing 890 milligrams of sodium, which is considered very high, and a 37% daily value, which is a lot of sodium, meaning this product should be avoided. On the right is the low sodium product, containing 140 milligrams of sodium, which is considered low, and 6% daily value, meaning this product would be a better choice to have. This table compares some common food products that are higher in sodium with a lower sodium alternative. At the top, we have Quaker instant oatmeal packets in maple brown sugar flavor with 260 milligrams of sodium, or 11% daily value of sodium, compared to Quaker plain minute oats that come in the large package that have 0 milligrams and 0% of sodium. So you can really see a big difference here in something like oatmeal that you may not have thought would even contain sodium, but sure enough, the more processed version does. Another example of regular V8 vegetable juice at 28% daily value versus their low sodium version at 6% daily value. So another large variation there. And then finally, maple leaf oven roasted chicken breast deli meat with 600 milligrams or 25% daily value compared to a plain roasted chicken breast that has just 56 milligrams or 2% daily value, which would just be naturally occurring sodium. Another quick way to read food labels for sodium is by looking out for content claims on the front of packages. In order for a product to list any of the content claims on the left-hand side of this table, they must meet criteria outlined in the right-hand column. These guidelines have been set out by Health Canada. Examples of sodium content claims include the words salt-free or no salt, lower salt or reduced salt, lightly salted, and no added salt. However, regardless of the content claim, always double-check the nutrition facts table to determine the exact amount of sodium in the product you are looking at. The third and final source of sodium in the diet is through naturally occurring sodium. Small amounts of sodium are found naturally in many of the foods we eat daily. However, the amounts are much lower than in processed foods. Examples include vegetables, eggs, unsalted nuts, whole grains, and meat like chicken and beef. This only contributes a small amount to our total sodium intake and therefore does not need to be limited. Food with more than 200 milligrams of sodium per serving is not due to naturally occurring sodium, but rather due to added sodium. Now let's talk about eating out. In general, it is more difficult to monitor the amount of sodium eaten at restaurants compared to at home, but there are some strategies you can try. Choose restaurants that can accommodate special requests, such as asking for menu items to be prepared with little or no salt. Select fresh foods or foods that are grilled, baked, or roasted versus processed or deep-fried foods. Ask for sauces on the side so you can control how much you use. Limit the use of high-sodium condiments. And finally, if you do order a high-sodium food, try to consume small portions and take a portion home for your next meal. Also, if you are eating at a larger chain restaurant or fast food place, they will often have the nutrition information for all of their food offerings. Here are some examples of the sodium content of common menu items at popular food chains. Some may be shocking to you. Pictured on the top left is Tim Hortons chicken noodle soup with 710 milligrams of sodium. On the top right, Tim Hortons ham and cheddar sandwich with 1230 milligrams of sodium. On the bottom left, McDonald's sausage egg McMuffin with 850 milligrams. And on the bottom right, Subway 6-inch meatball submarine with 1100 milligrams of sodium. All four of these examples would be considered high sodium items. If you require or prefer your meals prepared for you, there are a couple meal delivery services in the Niagara region that offer low sodium meals. These include Meals on Wheels Niagara and Heart to Home Meals. If you live in an assisted living facility, long-term care home, or retirement home where meals are provided to you, it is still often possible to follow a low-sodium diet. Communicate your dietary needs regarding sodium with the dietitian or food service manager at the facility. Here are some key takeaways to summarize this section of the presentation. Cook at home more often when possible. Eat more fresh or frozen fruit and vegetables which contain little sodium. Try to reduce the amount of added salt you add during cooking or at the table. Try out new seasonings and ways to flavor meals. Read nutrition labels to find low sodium products, and limit processed foods and prepackaged foods. Now moving on to the next section regarding a fluid-restricted diet. A fluid restriction is often recommended by physicians to manage heart failure. Drinking too much fluid can contribute to excess fluid buildup in the body. Speak with your cardiac specialist, such as your cardiologist or nurse practitioner, to determine whether you need to follow a fluid-restricted diet. Common fluid restrictions are 1.5 liters or 2 liters per day, but this does vary from person to person. If you have been told to follow a fluid-restricted diet, all liquids and foods that are liquid at room temperature must be considered in your limit for the day. This includes water, milk, juice, soda pop, coffee, tea, sports drinks, iced tea, lemonade, diet drinks, and sweetened beverages, as well as popsicles, ice cream, sherbet, jello, and ice cubes. Both cream and broth soups must also be added to your total fluid count. Some tips to manage fluid intake are as follows. Spread your fluid allowance throughout the day. Don't drink it all at once. Drink from small-sized cups rather than large. Drain all fluids from canned fruits and vegetables. And finally, keep track of fluids using a food journal. Some may find writing down fluid intake to be helpful, especially when first beginning on a fluid-restricted diet. Here are some ways to manage thirst. Chew gum or suck on hard candies. Drink frozen fluids as they will last longer before melting and can help quench thirst. Avoid highly sweetened beverages which may increase thirst. Brush your teeth or rinse your mouth with cold water or mouthwash. And finally, follow a low-sodium diet, which will also help to reduce thirst. This concludes the presentation. I hope you found it informative. Thank you for listening.